So what are the clinical features? It's very common, fever, chills because it's an infection, of course. Cough productive of yellowish greenish sputum. All right. So this is what is in the alveoli. So it will come out. All right. So when they cough, they'll have this nyama nyama thing. All right. Greenish yellowish sputum. Okay. Sometimes it may even be blood stained as well. All right. When it's very severe. So we can have dyspnea, difficulty breathing because, of course, they're not getting enough oxygen. They may have pleuritic chest pain because when let me see if I find a nicer diagram. Okay, you know that the lungs are covered by pleura, isn't it? So once the lungs itself are inflamed, the adjacent pleura can also get inflamed. Okay, so they'll have pleuritic chest pain when they take in a deep breath. They feel pain. They can also have tachycardia. Usually, when you have infections and fever and all of that, your heart rate goes up. All right. Okay. So when you do your examination, you realize that they have dull percussion notes. Okay, because if imagine that you have a barrel, an empty barrel or an empty gallon. If you hit it with a stick, you see children sometimes they take a gallon and they'll be using it to play drums, right? But the moment you fill that gallon with water, when you hit it with a stick, it won't make the sound it would have made if it was empty. You get it? So the percussion notes become dull because it's filled with it's consolidated. Okay, the lung spaces are filled up with fluid. All right, it's no longer like a balloon. Okay, and they'll have increased tactile and vocal fremitors. Usually, when you have consolidation, they have increased tactile and vocal fremitors. And then we also have bronchial breath sounds. Okay, your normal breath sounds is like short. The inspiratory phase is longer. So you take in a deep breath and then you breathe out short. Okay, but those with bronchial breath sounds, the inspiratory phase is almost at par. It's almost the same as the expiratory phase. So it's also very long, right? Something like that. You can go on YouTube and then listen for bronchial breath sounds. Okay.